I'm a senior nursing student here to check Taylor off on the ears, nose, and throat on today's date, which is September 25th.
I, Taylor Riley,
Lexi Templeton.
give verbal and written consent for this to be on YouTube for Liberty Nursing Program. Hi, my name is Taylor Riley. I'm a Liberty Nursing student. I'm going to be assessing your ears, nose, throat, and mouth today, okay? And can I get your birthday
Lexi Templeton.
and your birthday?
Oh, 10/4/1993.
That's good, and I would check your bracelet to make sure that was all right. All right, I'm going to be assessing your ears first. Your ears appear to be symmetrical. They also appear to be the same color of the rest of your skin. I'm going to feel for temperature, and they appear to be the same temperature. Was there any tenderness in that?
No.
Okay. A little bit about the ear. This is your helix, your anti-helix. This is your triangular fossa. This is your lobule, your tragus and your antitragus, and then your concha, and then your external auditory meatus. All right, next I'm going to look inside your ear, and this is looking at your tympanic membrane. Okay. And I don't see any signs of pus or exudate as well. Good, the tympanic membrane to be a pearly gray color. The light reflex is at 7 o'clock because it's on the left ear, but if it was to be your right ear, it would also be 5 o'clock. I see the umbo, the short process of malleus, and I also see your pars sensa, which is inferior, and then your pars faceta, which is your superior. And I also see your angle of malleus as well. Next, I'm going to do some hearing tests, and this is for cranial nerve 8. The first is a Weber test. I'm going to place this above your head, and when you stop here, or if you do hear it, let me know if you hear it in one ear or if you hear it in both, okay?
I can hear them both.
Okay, good. Next, I'm going to do the Rene test. I'm going to put this on your mastoid process. I need you to tell me when you stop hearing it, and when you do, I'm going to place it in front of your ear, and then tell me when you stop hearing that as well, okay?
Now.
Okay.
Now.
Okay. And that was a 2-to-1 ratio, and the air conduction is greater than the bone conduction. Next, I'm going to do the whisper test. I'm going to go behind you, and I'm going to whisper something to you, and I need you to repeat it back to me, okay?
Okay. A-E-B.
All right, good. All right, next I'm going to do the inspection and palpation of your nose. Your nose appears to be symmetrical. I don't see any signs of abrasions or scars or any foreign bodies on the outside. I'm going to palpate it for any tenderness. Do you feel any tenderness or anything? No. All right, good. I'm now going to look inside of your nose. Good. All right. Your nares appear to be oval. I don't see any signs of foreign bodies or bleeding. No signs of septum deviation, which would be a broken nose. I don't see any perforations, which would be any signs for drug use. I do see a few nasal hairs, but that's expected. It appears to be moist and glistening inside, and it's pink as well. I'm going to do the cranial nerve 1, which is the olfactory, and this is when I need you to close your eyes and hold one nostril for me, okay? I need you to tell me what you smell.
Coffee.
All right, now can you switch them for me? Good.
Coffee.
Good. All right, next is going to be inspection and palpation of your mouth. Your lips appear to be pink, they are moist. I don't see any signs of scars or abrasions. Let's see, I don't see any signs of cyanosis, which would be blue lips. They are also pink and moist as well. All right, can I have you open your mouth for me? Good. I don't see any signs of her tonsils, so I'd rate them at a 0 because that means they've been surgically removed. I also see your uvula. Can you stick out your tongue for me? Good. Can you move it from side to side and then up and down? Good. That's testing cranial nerve 12. And then can you stick it out again? Good. I see signs of papillae. And then I'm going to reach for her hard palate, and I also feel signs of Brugge. If she were, I wouldn't feel her soft palate, but if I were, that would mean she would gag, and that's testing cranial nerve 9 and 10. And if she also swallowed, that would be the rise and fall of the soft palate as well. All right, can I have you lift up your tongue for me again? Good. This is her frenulum. These are her Wharton ducts, and I don't feel any stones or masses. This is her Stenson ducts. And I don't feel any masses or stains. Was that tender?
Mm-mm.
No. I'm going to have you open up your mouth one more time for me, okay? All right, I'm going to feel for your teeth. Good. She has about 25 teeth. I don't see any scars or abrasions on the buccal cavity. Everything appears to be pink, glistening, and moist. There's no pus. And I also don't see any signs of fillings as well. This is her inferior frenulum down here, and then up here is her inferior frenulum.